is Joan Dineen, and I'm going to give you a brief overview of the point of care testing that is in the National Isolation Unit currently. So the benefits of point of care. The point of care devices of the National Isolation Unit provide the required accurate test results in a contained environment and a single patient in a timely fashion. Point of care devices resourced to provide the parameters decided on by the National Isolation Unit team. Normally, when we're requiring analyzers in the lab setting, our main requirements would be the analyzer performance, the cost. We'd look into training and those kind of things, but mostly the performance and cost. However, for the National Isolation Unit, there were other factors to consider, such as how user-friendly the analyzer is. It's going to be, the samples will be analysed by people in a highly stressful environment, high pressure. They won't be used to analysing samples like this, so the easier the analyzer is to use, the better. Also, the biological waste generated by the devices would be helpful if it's minimised. No wet waste, contained. That's what we were looking for. So we chose 4 devices. The ABL90 Flex blood gas analyzer provides your standard blood gas panel, also oxy, carboxy, and methemoglobin, sodium, potassium, ionized calcium, glucose, and lactate. The Skyla HB1 is the chemistry analyzer, and that provides albumin, alk-phos, ALT, AST, urea, creatinine, gamma-GT, glucose, total bilirubin, total cholesterol, total protein, and uric acid. So that's combined with the ABL90. That's your renal profile coverage, it's your liver profile, and the bones of a bone profile. The QBC Star was the FBC analyzer we chose, and that gives a condensed FBC, so hematocrit hemoglobin, MCHC, total white cell count, granulocytes, percentage granulocytes, lymphocyte monos, and percentages of monos, and platelets. The hemocron for the coag. Initially, we had considered, and we did purchase the Roche Coagi-Check, but we found during training that it wasn't terribly easy to use, that it was proving difficult for the users, that it was a finger prick sample and had very strict time constraints. So we reviewed it and decided to go with the Hemocron Signature 8, which we're currently doing the validation studies on. So it's a portable microcoagulation system. It's in use for other assays currently already in the hospital. We're going to run whole blood citrated PT and whole blood citrated APTT. So the reason we chose each one, the Skylab provides a wide range of assays. The waste is contained in the reagent cassette. See the cassettes in front of the analyzer, and basically it's like loading a CD. You put your blood into the cassette, put it into the analyzer, and it will eject it in 15 minutes when it's finished with it, and it can be disposed of in the biohazard bins. The analysis takes 15 minutes. It can be interfaced, so the results will go across to the patient's electronic records. It uses whole blood, there's no sample pre-preparation, and there's minimal maintenance. The QBC Star, it's a very fast analysis time of about 7 minutes. The waste is contained, it's a capillary sample which is contained in a plastic tube, sealed at both ends. It does its own internal tri-level control daily, and there's minimal maintenance to this also. The ABL90 Flex blood gas analyzer is what we currently use throughout the hospital already. We use the Safe Pico syringes, so as you can see there in this sample, you can squeeze the air out, and the cap at the top has a filter, so you have a sample with all blood, no air. It can sample through that cap after it's been mixed, and so that is the cleanest, safest way. There's no exposure, no clot catchers. The sample stays in the sample while being analysed. They can be monitored remotely through a Cure, which is available at any PC in the hospital, and we can see exactly what's going on the analyzer. The internal calibrations and QC is done daily on a rota schedule, and we can see if all parameters are functional and basically how the analyzer is getting on. There's an interface already in place, so the results go straight across to the electronic patient records, and it has a very fast sample analysis of 2 minutes. The Hemocron is a very low sample volume. Only 1 drop is required, approximately 15 microliters. It's very easy to fill the sample well, and there's an overflow reservoir just in case. It's got self-contained waste channel, which reduces the biohazards. There's a barcoded label which provides traceability, product type, lot, expiration date, all that stuff us scientists love to keep record of. There's citrated whole blood is what we're going to use. Our results will automatically be converted to plasma equivalent values, so that will be what the clinicians are used to, the similar figures. So for the training and competency of all these devices, the point of care team provided training in situ in St. Bernard's ward to the infectious diseases team and to the nurses involved. The initial training sessions were carried out while staff were just in regular clothes, just in order to familiarise themselves with the devices and the techniques involved. This was about 2 hours, approximately 30 minutes with each device. So we explained the processes involved, demonstrated it, and then the staff members provided, or they analysed samples themselves under observation from the point of care team. The main areas we cover will be the specimen types and requirements, the order of withdrawal, how much volume, the fact the coag citrate tube has to be filled to the liner, results are invalid, examination processes involved in each test, data interpretation, the results printout with reference ranges and flags, and criteria for when samples will need to be reanalyzed or even maybe repeat phlebotomy, possible interferences and limitations of each test. There are ongoing training sessions provided where clinical staff process samples on all devices while wearing their full PPE, just to kind of get a feel for it. People are wearing double gloves, might not be used to working with pets with double gloves. It is an extra challenge, so just so people are more comfortable using the devices. And the point of care training is run in conjunction with infection control, so when infection control are running their training sessions, we nab the staff as they're in their gear and analyse the samples with them, and then they go through with infection control again, how to take off the PPE. So the competency and training records are maintained by the point of care team. They keep track of how much training each user has had. We've provided everyone with laminated quick user guides that are beside each analyzer, that if they do need to reference something, they have a very simple guide for each analyzer. And there's also going to be detailed standard operation procedures available on Matternet if they need to require, and also they know that we're at the other end of the phone line as well. So an overview, we have 4 points of care devices selected, which will provide the National Isolation Unit with the diagnostic resources they have requested. The training has been completed by all staff on the infectious diseases team and in the National Isolation Unit. The competency assessment is ongoing, and it is necessary for staff to wear the PPE during competency assessment. So as I'm stepping in, I am available to answer any questions people have, or alternatively, if you want to email Claudia Gorman, the Chief Medical Scientist in Point of Care, with any other queries you might have. Thank you very much.